assessing movement here of the AC joint is you want to grab a hold of the acromion like this. But what I want you to think of is that, can you hand me one of the markers, please? Is I want you to imagine that the border where the acromion and the clavicle come together is shaped like that. Okay? So I want you to imagine that the acromion is a very female surface with the clavicle being the male surface, even though I know it's not like that exactly, okay? But if you imagine it this way, then you'll realize that the way you have to assess this is just not going this way. It's by trying to take this and go like that and like that. So it's, you are gliding it forward, but I'm gliding it in this direction here, and then I'm pulling it back in that direction there, okay? So that establishes the correct, because look how much I can pull her posteriorly, okay? Anteriorly she holds, but posteriorly there's a big gap there in that joint, okay?
Are you looking for laxity or pain?
I'm sorry?
Laxity or pain, or both?
Both, because then what I would do would be to come over here and I would repeat the test. See, her joint line is right there. I'm doing the wrong thing here. Where's her? Here's her clavicle. There we go. Okay, her joint line is right here. Okay, and as I move it here, okay, when I do this posterior, I feel the ligament tighten, and I don't feel, there's no step. Okay, so the bones, I feel the soft tissue tension tighten, but there's not a step off between the clavicle and the acromion. But on this side there is. It's several millimeters long. Okay, so that's what you're feeling. All right, at least when you take it posteriorly. For the anterior movement, you just have to try to assess. Okay, well, do I feel it? I guess you could see if there's a step on the anterior movement by really bracing the distal end of the clavicle and trying to push that acromion in that rounded direction forward, and then see if you feel the acromion go too far forward there. But hers doesn't, and it didn't over on this side either. So she still has nice stability. So see how I'm really hanging on to the distal end of the clavicle as I rotate the acromion anteriorly here. But now I'm really holding on to the clavicle with both of my hands as I try to pull it posteriorly like that. And like I said, there's a palpable step between the distal end of her clavicle and her acromion then. Okay? And then obviously if this was a painful joint, then they'd be going, yeah, that's hurting. Okay? The other thing as you do that assessment is you might feel crepitus. So if you feel grinding and crepitus in there, it's obviously telling you that it's arthritic. You do remember there's a disc in that joint. But I forget, like by the time you're 30-something or whatever, it's pretty much gone in everybody. So the older you get, the more you might feel that crepitus in that joint. Okay? So that's really the only way to assess movement. And for me, once I was taught that it's a curved linear movement, not just a straight forward and back, then I was able to feel the movement very nicely every time. Whereas before I was just trying to shove it anteriorly, shove it posteriorly, and I couldn't always feel the movement. So it's a curved linear movement. Okay? So that's how you assess the movement. And again then, all you could do would be to, manually try to mobilize it in those directions. Now, there is on page